Hi guys, this is Michelle Gravengood and this is my presentation on complementary and alternative healing. So the type of therapy that I chose was acupuncture, and this is a traditional Chinese medicine that they created. And if you're not familiar with it, it is the insertion of thin needles through your skin that targets certain pressure points in your body. And it's based on the belief that there are invisible channels in your body known as meridians. And if you're not familiar with this, we'll talk a little bit more about it in the upcoming slides. So, a really fun fact that I learned about acupuncture is they typically begin the treatment with examining the tongue. And they look at the shape, the color, and the coating to determine the type of acupuncture to use on the person. And another thing they do is they check the pulse strength to determine the type of acupuncture to use as well. So, some really fun facts about this therapy. So, just a little bit about the process of it. What they do is they insert between 5 and 20 needles, just depending on your complaint. And you're going to experience a mild aching sensation, which means that they're doing it right. You're supposed to be feeling this. A lot of people might think that acupuncture is painful, but it's really not. It's just kind of an aching sensation. The needles are going to remain in place for about 10 to 20 minutes, so not very long. And the acupuncturist might gently move or twirl the needles to stimulate the pressure points even further. So, some people have reported that they felt relaxed or even energized after the procedure, which is a really great benefit to it as well. So, some background or history about it. They've practiced this type of therapy in China for over 2,000 years. And it comes from the belief that illness and symptoms occur when the energy is blocked or imbalanced. And the way to unblock the energy is by stimulating these pressure points on the meridians that I previously talked about. So, some interesting things about acupuncture is that sometimes the placement may have absolutely no relationship to the affected area. For example, if you're having a headache, the acupuncturist might put a needle in your hand, which you wouldn't think would stimulate and help with pain relief in your head, but it does. So, some uses for this type of therapy, there's an endless amount of uses for it, things that you wouldn't even think of that it can be used for. But the number one reason a lot of people go to acupuncture is for pain relief. Any type of pain that you're having, whether it's chronic, acute, can pretty much be helped with acupuncture. And people that are having problems with quitting smoking, a nicotine withdrawal is another reason that people can use acupuncture. Chronic migraines, cancer patients that are having nausea and vomiting from the chemotherapy treatments. And they've also found that patients that have had strokes have a better rehabilitation process when they use acupuncture because it helps stimulate those muscles that have been damaged. And then also chronic asthma, if you have carpal tunnel syndrome, and just overall stress management because it helps you relax and feel energized, which is also another reason why a lot of people utilize this therapy. So, some benefits of it, I thought this picture did a great job at outlining just some basic benefits of it since there are so many. But it can help with insomnia, people that have problems with sleeping. It can just relieve overall stress and anxiety. Like I talked about previously, it can give relief from nausea and vomiting. It can be used for treating chronic migraines, headaches, and neck pains. My dad uses acupuncture weekly for his chronic migraines, and it's helped him immensely. And it helps reduce heartburn and indigestion. It can provide relief from chronic pain and arthritis, like we previously talked about. It can even help improve your vision, any hormone balances, like women with irregular menstruation, it can help with that. Any fertility issues and erectile dysfunction in men. Some other benefits are respiratory disorders, depression, and it can help treat high blood pressure. So, this would be a great therapy to recommend to your patient that may be struggling with managing their blood pressure. Some risks and precautions to think about with this therapy is just some common side effects are going to be soreness just from where the needle penetrated the skin. And then you might even have a little bit of bleeding and bruising from where the needles penetrated the skin as well. So, what you want to be careful of if you do utilize this therapy is if you have a bleeding disorder. So, bleeding from the needles increases if you have a bleeding disorder or you're on blood thinners. And then if you have a pacemaker, sometimes acupuncturists will send mild electrical impulses through the needles, and this can interfere with the function of a pacemaker. So it's important to be aware of this prior to having this therapy performed. And then if you're pregnant, this can stimulate labor, which can lead to premature delivery. So it's really important to look at this risk when you're utilizing this therapy if you're pregnant. But overall, it is really relatively low risk and has very minimal side effects for all the benefits that it can provide. Some limitations to it is it does take time to feel relief. You're not going to feel relief instantly. You may feel energized, you may feel relaxed, but maybe your pain won't go away right away. It's going to take a couple treatments. So, like I said, you're going to have to attend a couple treatments to see improvement, and sometimes that can be a hassle for patients to find the time to attend those sessions. And oftentimes, treatments are not covered by health insurance. So, if you have patients that are low income, this might be a barrier for them. And it obviously cannot cure physical ailments like broken bones. It's not going to cure those, but it is going to help immensely with pain and other problems we talked about. It can cause pain if the needle is not properly inserted. So, this is why it's so important to make sure that you have a certified acupuncturist that knows what they're doing. And they found that if you have a positive attitude about acupuncture and you believe it's going to work, you're obviously going to get the best results. So, application to nursing practice. So, this is definitely a type of holistic nursing care that we can utilize for our patients, and it really can be used in any type of nursing practice. Whatever unit you work in, whether it be labor and delivery, whether it be the PACU, any type of unit, this type of therapy can be recommended to your patients. And another type of therapy that we as nurses can utilize ourselves without having to get as many certifications as you would for acupuncture is known as acupressure. And it's virtually the same thing as acupuncture, except you're not using needles. You're just using your hands to firmly press on those same pressure points. So this is something that we as nurses can do for, let's say, patients that just received chemotherapy and are very nauseous. So to help ease that nausea, we can use our fingers to put pressure on the wrist, which is a pressure point to relieve nausea. So same for like post-operative nausea and the PACU. If that medication's not working, this is a way to help relieve that. Like we talked about, women who have irregular menstruation, we can teach them pressure points that they can utilize themselves to help with that. And then maybe working in labor and delivery, you can utilize this to help with labor pain and help ease that labor along if the medication is not working as well, or maybe they want to do an all natural labor. Some patient education is there are very minimal side effects that occur with this therapy, but it doesn't work for everyone. You're not going to see 100% improvement in every patient. You are going to have a minor ache that's going to be felt with the insertion of the needles, and the treatments aren't typically very long. They last for about 30 minutes, so pretty easy to do in your schedule. And treatment for one complaint usually occurs about 1 to 2 times per week. So patients are going to want to see their acupuncturist a couple times a week to really get the best results. And then it also boosts the body's natural painkillers. So it's like taking pain medication but without having to take it. So, conclusion is acupuncture is a very low risk therapy that can provide a lot of benefits to patients. It treats a wide variety of problems that we talked about, and acupressure is something that we as nurses can utilize and can be directly implemented by nurses rather than having to refer our patients to an acupuncturist. So, this is something to think about for us as future nurses. So, some questions that I have for you are, what are some other ways that were not mentioned that acupuncture or acupressure can be utilized in nursing practice? Would you personally, as a future nurse, recommend this therapy to your patients in the future? Why or why not? And here are my references. Thanks, guys.